Welcome to another episode of Kottakkal's Health Awareness Campaign. I am Dr. Rejuvenate, Medical Director and Consultant Physician, Kottakkal Ayurvedic Medical Centre, Ajman. We all are aware that this world is battling with the pandemic. This is the toughest time of all ages. Regarding post-COVID rehabilitation, Ayurvedic therapies, the response so far has been encouraging. The areas of rehabilitation to be considered are physical rehabilitation, cognitive and mental rehabilitation, pulmonary rehabilitation. Physical rehabilitation. Post-recovery, patients are facing varied degrees of constitutional or residual symptoms such as low-grade fever, inflammation, digestive or metabolic dysregulation, respiratory ailments, breathing or lung capacity issues, respiratory tract infections, cough, nasal block, etc. And also general fatigue, weight loss, body ache, joint pains, loss of smell and taste. Cognitive and mental rehabilitation. Apart from the physical issues, patients are also struggling with psychological issues ranging from stress, sleeplessness, depression, memory loss, troubling concentration, brain fog, dramatic mood changes, etc. Some people who experience trauma go on to develop post-traumatic stress disorder, which causes longer lasting symptoms including flashbacks, nightmares and hyperarousal. This may be particularly likely in people who needed to stay in an ICU or an emergency medical care. Next is pulmonary rehabilitation. Pulmonary rehabilitation includes reducing the shortness of breath, improving lung capacity, managing any respiratory complications, reducing the impact of respiratory symptoms on mental health. Ayurvedic Management. Ayurvedic Management post-COVID aims at solving the severe deterioration of the tissues, gaining the lost potential or energy, and treating the complications in a natural way. Stay strong post-COVID with the natural care. Thank you.